You actually know what amoxicillin used for, how to take the right dosage, or what side effects to watch out for? And what about during pregnancy or breastfeeding? Is it safe? Can babies or elderly people take it too? Today, we are going to clear up all that confusion in simple language, so you will understand exactly when amoxicillin helps, when it does not, and how to use it safely without risking your health. Let us get started. So, let us start with the basics. What exactly is amoxicillin? In simple words, amoxicillin is an antibiotic. That means it is a type of medicine that helps your body fight bacterial infections, not viruses, only bacteria. It belongs to a group of antibiotics called penicillins. You might have heard of penicillin. It is one of the oldest and most trusted antibiotics we have. Amoxicillin is like a newer, improved version of it that can handle a wider range of bacteria. What it basically does is stop bacteria from building the walls they need to survive. Without that wall, bacteria cannot protect themselves, so your body's immune system can finish them off more easily. So, in short, amoxicillin helps your immune system win the fight against certain bacterial infections. Alright, now that we know what amoxicillin is, let us talk about what it is actually used for. Doctors prescribe amoxicillin for all sorts of bacterial infections. It is kind of a go-to antibiotic for many common problems. For example, it is often used for throat infections like strep throat or tonsillitis. If your throat is sore and the test shows it is caused by bacteria, amoxicillin might be prescribed. It is also used a lot for ear infections, especially in kids. That is one of the most common reasons children get this medicine. Then you have got sinus infections, chest infections like bronchitis or even pneumonia, and urinary tract infections, which many adults are familiar with. It is also helpful for certain skin infections, like cellulitis, where bacteria get under the skin and cause redness, pain, or swelling. Okay, now let us talk about the part everyone always wonders about, the dosage. The truth is, the exact dose of amoxicillin depends on a few things, like what kind of infection you have, how severe it is, your age, and even how well your kidneys are working. But just to give you a general idea, for adults, it is usually somewhere around 250 to 500 milligrams every 8 hours, or sometimes 500 to 875 milligrams every 12 hours. For kids, it is a bit different. Their dose is carefully calculated based on their weight, so your doctor or pediatrician will tell you exactly how much and how often. You can take amoxicillin with or without food, but if it tends to upset your stomach, it is usually better to take it with a meal. Now amoxicillin actually comes in a few different forms, depending on who it is for and how easy it is to take. For adults, you will usually see it as tablets or capsules, commonly 250 milligrams, 500 milligrams, or 875 milligrams. For children, there are chewable tablets or a liquid form, that is called an oral suspension, and it is easier for infants or kids who cannot swallow pills yet. There is also an extended release tablet, which is a longer-acting version, sometimes used for things like sinus infections. So, the form your doctor gives you really depends on your age, infection type, and what is easiest for you to take. And of course, one of the most important things, even if you start feeling better after a couple of days, do not stop the medicine early. You have got to finish the full course your doctor prescribed. Stopping too soon can let some bacteria survive, and those leftover bacteria can become resistant, which means next time, that antibiotic might not work as well. So, take it as prescribed, take it on time, and do not skip doses, unless your doctor tells you to. Alright, now, let us talk about some important cautions. Situations where amoxicillin should either be avoided or used carefully. The first and most serious one, for if you're allergic to penicillin, or to any other antibiotics in that same family, like cephalosporins. If you have ever had a rash, swelling, or any severe reaction after taking those, you should not take amoxicillin. Allergic reactions can be dangerous, sometimes even life-threatening. Second, if you have kidney problems, your doctor might adjust your dose. That is because amoxicillin leaves your body through the kidneys, and if your kidneys are not working well, the drug can build up in your system. Another thing that is not very well known, if you have something called mononucleosis, or mono for short, you should avoid taking amoxicillin. It does not help with that illness and can actually cause a rash that looks pretty alarming. Now a lot of people ask, is amoxicillin safe during pregnancy or while breastfeeding? Generally speaking, amoxicillin is considered one of the safer antibiotics during pregnancy. It has been used for many years, and studies have not shown any major problems when it is prescribed properly. But even though it is generally safe, that does not mean it should be taken on your own. Always use it only under a doctor's supervision, because your situation, infection type, and stage of pregnancy all matter. Now, about breastfeeding. Small amounts of amoxicillin can pass into breast milk, but it is usually considered safe for most nursing mothers. In rare cases, your baby might get a bit of loose stool, a mild rash, or some tummy upset, but those effects are typically mild and temporary. If you are breastfeeding and your doctor prescribes amoxicillin, just keep an eye on your baby. And if you notice anything unusual, let your doctor know. So, in short, yes, amoxicillin can usually be used safely in pregnancy and breastfeeding, as long as it is prescribed and monitored properly. Alright, now let us talk about using amoxicillin in older adults and children, including babies. For elderly patients, amoxicillin can still be very effective, but doctors usually keep an extra eye on kidney function. As we get older, our kidneys may not clear medicines as quickly, so sometimes the dose needs to be adjusted. Regular monitoring helps make sure the antibiotic works well without causing side effects. For infants and children, amoxicillin is actually one of the most commonly prescribed antibiotics, especially for things like ear infections, throat infections, and chest infections. The important part is that the dose is always based on the child's weight, not just their age. That is why it is never a good idea to guess or reuse an old prescription. The doctor or pediatrician will carefully calculate how much your child needs. Also, for little ones who cannot swallow pills, amoxicillin comes as a sweet-flavored liquid called an oral suspension. It is easier to give, but parents should make sure to shake the bottle well before each dose and measure it accurately using the syringe or spoon provided, not a regular kitchen spoon. So, whether it is for older adults or for kids, the key idea is the same. The dose and form should always fit the person's needs, and it should be guided by a doctor. Now, like any medicine, amoxicillin can have side effects. Most are mild, but it is still good to know what to watch out for. The most common ones are usually stomach-related, things like a bit of nausea, loose stools, or mild diarrhea. These often go away on their own once you finish the medicine. Taking it with food can sometimes help reduce that stomach upset. Another thing some people might notice is a skin rash. If you ever develop a rash while on amoxicillin, it is important to tell your doctor, especially if it is itchy, spreading, or comes with other symptoms like swelling or shortness of breath. Now, serious allergic reactions are rare, but they can happen, and they are medical emergencies. If you ever feel your face or throat swelling, if you are having trouble breathing, or you suddenly feel dizzy or faint, that is a red flag. You need to seek emergency care right away. Also, sometimes antibiotics can upset the balance of bacteria in your gut, which might lead to other minor symptoms like gas or stomach cramping. Drinking plenty of water and eating light foods can help while you are on the medicine. So, to sum it up, most people do just fine on amoxicillin. But if anything feels unusual or severe, do not ignore it. Always reach out to your healthcare provider. Alright, before we wrap up, let us quickly go over how to use amoxicillin safely, because taking it the right way makes a big difference in how well it works. First, you can take amoxicillin with or without food, but if it tends to upset your stomach, it is better to take it after a meal. Drink plenty of water while you are on it. That helps your body process and flush out the medicine properly. Always finish the full course your doctor prescribed, even if you start feeling completely fine halfway through. Stopping early can leave some bacteria alive, and those leftover bacteria can become resistant, which means next time the antibiotic might not work as well. If you ever miss a dose, just take it as soon as you remember, unless it is almost time for your next one. In that case, just skip the missed dose and continue with your regular schedule. Do not double up. And here is a big one. Do not share antibiotics with anyone else, even if they have similar symptoms. The same infection name does not always mean the same cause. What works for you could be totally wrong for them. Finally, always store amoxicillin at the right temperature. For liquid forms, especially, keep them in the refrigerator if the label says so, and make sure to discard them once they expire. Following these small but important steps keeps you safe and helps the medicine do its job properly. Alright, let us wrap it up. So today, we talked about amoxicillin, what it is used for, how to take it, and the precautions you need to keep in mind. Remember, amoxicillin is a great antibiotic when it is used the right way for bacterial infections under a doctor's supervision. But it is not a cure for everything, and it definitely will not help with viral illnesses like the flu or common cold. The key takeaway here is simple: use it wisely. Take the right dose, finish your full course, do not share it with others, and if anything feels off or you are unsure, talk to your healthcare provider. Antibiotics are powerful tools, but when we use them carefully, we help protect not just ourselves, but everyone by preventing antibiotic resistance. I hope this helped clear things up for you. If you found this helpful, give it a like, share it with someone who might benefit, and do not forget to subscribe for more easy-to-understand health explainers. Thanks for watching, and take care of yourselves. See you in the next one.